Mental health care in Liverpool, Sefton and Kirkby is changing for the better. 1 in 4 people are likely to experience a mental health problem during their lifetime, and some of them will need care within an inpatient setting or support from local mental health community teams. The improvement of care for these people has always been a core principle of the Mersey Care NHS Trust. Formed in 2001 as a specialist mental health and learning disability trust, the trust inherited poor buildings with over half of the inpatient wards predating the formation of the National Health Service. An assessment at the time found up to 3/4 of the adults' mental health service was unfit for purpose and needed a complete transformation. Services for people like Sean, who has lived for many years with mental health issues and experienced inpatient care delivered in buildings that were not suited to a modern therapeutic philosophy.
But staying at the unit, you know, it can be a traumatic experience at times. Obviously, you're trying to recover from mental illness, and when you're sharing a dormitory with 3 other lads, you're trying to recover, you're on different types of medication. It can be hard, you know, there's lads shouting through the night and there's no privacy. For the new environment, I'd like to see everyone with their own bed space, you know, their own little private area, place where they can get washed, where they've got their own showers, their own wash facilities, their own bathroom. Also outside facilities, you know, where people can go and get some fresh air when they want, go and exercise when they want. Maybe a private area on the ward itself where, you know, you can go and have a little one-to-one with a staff member over a certain issue you might have. Just, as I say, just a bit of privacy and dignity while you're trying to recover. You know, that's all anyone can ask for.
To drive forward the development and improvement of the mental health services delivered by Mersey Care, the TIME project was created. This innovative project is working together with stakeholders, service users and local communities to develop a brand new centre, bringing significant improvements for everyone needing inpatient care and treatment or mental health services in the community, in a modern and therapeutic environment. A once-in-a-lifetime opportunity, and it will see the construction of high-quality facilities that will transform the way mental health care is delivered. But it's about more than just the bricks and mortar. It's about improving the care people receive and increasing their speed of recovery. Creating an environment which encourages service users to play an active part in their own recovery. Improving the working environment for staff. It's about improving engagement with the community and reducing stigma. Hundreds of people were consulted and involved during the design and development of the concepts.
One of the things that is really, really clear is that we might be the client in that we decide that we want to build hospitals or build spaces, but we're not necessarily the people who are using them. The people who will be using them are the users and the staff, and also the relationship that we have with our local communities and the environment.
A major landmark was reached when the Treasury finally announced its approval of the funding in the autumn of 2011, and the work could finally start on the construction of the new centres.
I'm hopeful these 2 new buildings will transform the services. I think they will improve dignity enormously. They'll improve the therapeutic environment, and I hope they'll create an entirely different feel for where care is delivered.
The findings from the consultations were reported back to the TIME project team, now led by John Doyle and Sam McCumisky, and the concept started to crystallise, following the 5 principles of well-being.
To be able to have designated rooms for particular activities and service users with their own single rooms is something that we're really excited about, and we feel that it would be beneficial to both staff and service users. The outside space is something that we're really keen to develop really, and staff have had lots of input into how that's going to be laid out and how that's going to help to embrace the outside and bring it into the wards as well.
The new facilities will be built on the old Walton General Hospital site in Rice Lane and the derelict Ian Skelly car showroom at Edge Lane next to Rathbone Hospital. Each building will house 85 beds across 5 inpatient wards, providing modern mental health care provision for local adults. They will offer privacy and dignity for patients, with single ensuite bedrooms and safe access to beautiful garden and activity spaces. The two centres will provide learning, meeting, therapy and consulting spaces for community teams, as well as a cafe, 2 family rooms and a tribunal suite. Demolition of the site at Walton began in September 2011, with the expected clearing of the site in Edge Lane to be completed in 2012. Construction of the new buildings will begin early in 2012, bringing new life to the 2 local areas.
I'm really pleased about the project. I can't wait for the thing to be built and for it to be in operation. It's going to bring new life to the area. I am so pleased to be stood here today, watching Jaws and being able to share with everybody in my community the beginning of the end.
It's hoped the doors will open for business by 2014. The investment in improving mental health care delivers a clear message that Mersey Care are fully committed to reducing the stigma associated with mental health issues and making sure the services are delivered right where they are needed, closer to the local community. The Time project has listened to what the local communities wanted, and now they really are starting to deliver.